Transcranial direct current stimulation and schizophrenia. Schizophrenia is a complicated mental illness. A notable effect that schizophrenia has on people is impairment of cognitive insight, which has been shown to predict negative outcomes regarding medication adherence and clinical treatment by Lysica et al. In 2018. Gerritsen et al. In 2014 distinguished two forms of insight, that being clinical insight and cognitive insight. Clinical insight refers to the awareness of the illness had by the patient, reported by the clinician, while cognitive insight refers to the ability to identify and correct distorted beliefs. Bushi et al. In 2009 proposed that the physiological mechanism for cognitive insight is linked to hippocampal volumes, which are crucial for memory. Gao et al. In 2021 proposed TDCS to target this mechanism via studied NMDA-dependent neuroplasticity. NMDA receptors in the hippocampus being essential for the formation of contextual and trace memory. The field of research around TDCS helping schizophrenic patients through cognitive enhancement holds many complications, as some research suggests the aforementioned notion of medication adherence and planning ability. The other research warns against promoting cognitive insight alone due to the increased levels of depression and suicidality. This literature review aims to evaluate the research and suggest future strategies. Yokio et al. In 2017 described transcranial direct current stimulation, or TDCS, as a treatment where weak direct electrical current is applied through electrodes to the brain with the aim of neuromodulation. TDCS has been studied by Narita et al. In 2017 to help cognition in patients in various ways, such as verbal memory, verbal fluency, and motor function. Although TDCS does not act as a direct cure, the attempt to treat memory and therefore cognitive function via NMDA-dependent plasticity is proposed by Penn et al. In 2009 as an action that could be taken to improve further treatments with cognitive behavior therapy. A study by Chang et al. Attempts to measure this very phenomenon, looking at the effects of TDCS, what they are on not only clinical and cognitive insight, but also illness severity, neurocognitive function, and functional outcomes. The findings of this study showed promising results around the improvement of cognitive insight and planning ability, but reportedly required follow-up research to further test this conclusion. Due to their emphasis on cognitive deficits and enhancements in the literature around schizophrenia, the literature around cognition alone is important to consider. NMDA receptors are studied as a target for cognitive enhancement due to their widely accepted role in plasticity and memory, with suggestions towards potentiation of NMDA receptors for cognitive enhancement by Collingright et al. In 2013. TDCS has been studied to induce NMDA-dependent plasticity via long stimulation durations by Ganavati et al. In 2022, which suggests a promising route for further studies around TDCS and schizophrenia. However, a meta-analysis from 2020 that looked at studies measuring cognitive performance before and after TDCS sessions suggests that the duration of stimulation did not pose significant results across studies. The more notable difference between studies came from the number of sessions, ranging from 2 to 40 between studies. This also came up with no significant change on effect size regarding cognitive performance. With this evidence and consideration to aforementioned studies that had promising yet not convincing results with direct treatment with schizophrenia via TDCS, it is fair to suggest at this point in the research and literature, TDCS cannot be relied on for treatment, but should be further looked at as a tool for initiating appropriate state of mind for further cognitive behavioral therapy. Due to the evidence around cognitive enhancement on its own, patients may benefit from TDCS for promotion of behaviors that assist in treatment, such as planning ability, suggested by Chang et al. In 2019, but due to the inconclusive nature of the evidence, it may be unethical to persist down this route of treatment. The reason for this argument of ethics relates directly to the nature of the research. The most promising findings were found in the aforementioned study by Chang et al. In 2019, but the limitations reported in this study create complications in the field of research. The authors stated promising findings around planning ability for patients, but mentioned what is called the insight paradox. This is the notion that schizophrenic patients with heightened cognitive insight are at a higher risk of depression, backed by a study done by Kao et al. In 2011. Even more concerning are other studies suggesting higher rates of suicide in schizophrenic patients with higher cognitive insight done by Lopez et al. In 2013. This creates vast complications in the research and emphasizes the need for cognitive behavior therapy, as there are arguments made in studies for the betterment of patients via cognitive insight, and equally convincing arguments made by other studies around the negative impacts of cognitive insight, which is one of the main goals of change in TDCS treatment for schizophrenia. Within this research, there are also limitations around sample recruitment due to ethics, as low insight into the condition blurs the lines of informed consent to treatment. Changatel in 2019 mentioned the limitations of their sample based on the notion that the patients who participated were volunteers who had to have some insight into their illness to seek treatment, but this limitation is difficult to amend when considering the need for informed consent around treatment, especially treatment that may pose serious risks around depression and suicidality for schizophrenic patients in particular. To conclude, although the promotion of neuroplasticity via treatment targeting the mechanism of the hippocampus and NMD receptors is promising, within schizophrenic patients there is not a common significant effect on cognitive performance. With counteracting perspectives on cognitive insight being presented through the literature, it is possible that more variables involved with cognitive insight are important to consider before further attempts at promoting it are made, such as rigorous cognitive behavioral therapy to accompany it and consideration to the samples that are used in trials, even if this may mean more severe cases cannot be helped with the treatment.